Good afternoon, everyone, and welcome to the Common Ground 2021 Open Enrollment Training. Just a reminder, if you could mute your microphone if you logged in through the link, or if you're on the phone, if you could mute that would be great. We do have a chat box in the upper right-hand corner. You can type any questions you have in during our presentation. We will answer all of them at the end. We're also saving a list of all the questions we've gotten through our 4 sessions, and that'll be part of a big email that we're sending out tomorrow that will include all our presentation and PDFs of our benefit grids, and anything that you would need during open enrollment that you would have received from us in person at one of these sessions. All right, so we will get started. So as far as our 2021 sales team, Chief Business Development Officer is Brian McDonald. We do have a new Director of Sales, Deb Trinan. She just joined us in August. She is coming to us from Dean. I believe she was there for about 12 or 13 years, so she has great experience. We're very happy to have her. Account executives, myself, Megan Enerson, and Jim Wood. Sales advisor, broker service specialist, April Schultz and Heidi Heiches. Heidi is also new, and she is joining us from National General. She also started in August. And then we have our marketing manager, Gabby Davies, and our sales and operations outreach coordinator, Katie Gresk. So our agenda today, we'll just touch on our mission, who we are, the current state of the cooperative, coverage and benefits, reminders and updates. So yes, we will be touching on rates for 2021, as well as our new commission schedule. So our mission continues to be putting members first, pursuing better healthcare. And I know a lot of you have been with us for a while, but in case we have any new brokers or agents on the phone, what is a cooperative health insurance company? Common Ground is a nonprofit. We're operated for the mutual benefit of our members. Any earnings we make are returned to our members in form of lower prices and improved services. We are run by a board of directors, and that board of directors is made up of a member. You have to be an active member to be on our board of directors. So if you ever have anyone in mind, they do have the opportunity to run for the board. We have elections each May. And we are sending out MLR rebate checks again. This is for our 2019 members, and we'll cover that. And as far as the impact of COVID-19, we wanted to help out our current small groups. So we are currently, through the end of this year, reducing their monthly premiums by 50%. We did also do that for them in the month of May. So our current membership of the co-op is 52,000. There are 93,000 lives in our service area who have the opportunity to purchase through the exchange. So we own 52,000 of those, which makes us Wisconsin's largest ACA health insurance carrier, as well as that gives us 54% of the market share. Over 45% of our members are enrolled through a broker and agent, and we absolutely love that. You guys do such a great job educating them, getting them through the tough spots, and you make our jobs a lot easier. So thank you so much for your partnership. Once again, we were recognized by the Milwaukee Journal Sentinel as a top workplace for 2020. And then we did do a couple surveys this year. In a survey we sent out, 95% of our responding members stated they had a good experience with Common Ground. And then we also sent out a Net Promoter Survey and scored in the top percentile for that. So let's take a look at both of those surveys. So the first one was the Member Experience Survey. It's just one question. Have you had a good experience with Common Ground as your health insurance carrier? So 95% of the participants who took that survey said yes, and 5% said no. Once you answer that question, we do ask if you want to participate in our Net Promoter Survey. So Net Promoter Survey, it basically is asking members if they would promote us. Would you recommend us to a family member or a friend? The survey also helps us determine customer satisfaction, member feedback, ways to improve, and how to create loyalty. This year we had 4,238 participants. The benchmark score for this survey is 24. This year we scored a 59. Last year we scored a 39, so we are happy for sure about that improvement. So as far as the participants, 70% of the survey participants did say they would be promoters for us, meaning that they scored us at a 9 or 10 on the survey. As far as improvements that they wanted us to make, they mentioned website updates, so we definitely think that has something to do with JET. There's definitely some kinks with that, but we think we've ironed those out. Keeping costs down, we did reduce our rates for 2020, but unfortunately we have no control over the tax credits that go out through the marketplace. And then network expansion, we do like to keep our network on the smaller side in order to keep our costs down. So as far as MLR rebates, we just started sending those checks out on Friday, September 18th. So you might be getting some phone calls on those. So this is the second year we've been able to do this. And we do think that as far as this year and last year, we're the only Wisconsin carrier that has sent these out to our members. So we really like that. We think it sticks with our mission, people not profit. We did have the choice to implement the money in another form of a benefit to members, but issuing money back in checks just seems the most transparent way to do so. So MLR rebates come about if the carrier does not spend at least 80% of the premiums collected on healthcare services. They must reissue that back in form of a benefit to the policyholders. So we choose to send a check. This year, 58,900 checks are going out, and that's for members who had coverage with us in 2019. This can be members who were with us for a month or for the whole year. Anyone will get a check, whether you're direct with us or through the marketplace. It doesn't matter if you are making a premium of 25 cents or $1,400. Everyone gets a check. Keep in mind that the check is based on total amount of members' premium. So that's where I think people get confused. If they're on the FFM, they're only making a payment of $1.50 and they get a check for $300 in the mail. This is correct. They can cash that. And these are guidelines that FFM sets up. So that's where that calculation comes from. So a couple of questions that came in last year when we sent these out. First and foremost, is this real? Yes, it definitely is, and you can cash these. Another question is, when you get this check and you cash it, would you then have to go back in your FFM application and update your income for 2020? And you do not. You do not need to consider this as income for 2020 or 2019. We do not send out 1099 forms on these. If your members happen to have any other specific tax questions, we definitely recommend that they reach out to a tax professional. All right, so 2021 coverage plans and benefits. We are introducing 2 new counties, so we'll touch base on that. And then we'll talk about Dickinson County Healthcare. And Jim will take over and talk about individual plans. So this is our service area map for 2021. We are in 22 counties now, so we are adding Florence and Green Lake counties. Otherwise, all the counties remain the same. Okay, and taking a look at 2021 Envision Network. So major players are still in. We have Aurora, Bellin, Theta Care, Children's, Door County Medical Center, St. Joseph's Hospital. Please keep in mind that just applies to the Milwaukee campus. And then Dickinson County Health Care System. Dickinson was in network with us in 2020, but adding Florence County is going to offer members much more utilization with that healthcare system. And so taking a look at locations for Dickinson County, we do have Florence Medical Center that is located in Florence, Wisconsin, provides family medicine, lab, and diagnostic services. And we have Dickinson County Hospital that is located in Iron Mountain, Michigan. And then also Dickinson Family Practice Centers. There are 2 clinics located in Norway, Michigan. Provides geriatric family practice and primary care. If you need more information on that healthcare system, there is a nice link there. Okay, and the Envision EPO network. So we are remaining an EPO, which stands for Exclusive Provider Organization. This means members must receive care from an in-network provider, and this enables us to offer lower provider rates. All members are going to be in Envision EPO network in 2021, so that includes individual and small group. Members do not have to have a primary care physician get a referral. They don't need a referral from primary care physician to see an in-network specialist. If a member sees an out-of-network provider, services would not be covered unless, of course, they needed emergency care, urgent care, but that would be only outside of our 22 county service area. And then, of course, if there's not an in-network provider who can provide medically necessary services, members can get a written referral from their in-network provider, and then it does have to be approved by Common Ground prior to services being received. All right, so I'm going to hand it over to Jim Wood now, and he'll start you out by taking a look at our base plans for 2021.
Okay, thanks, Megan, and good afternoon. Thanks, everyone, for taking time out of your schedule to be with us this afternoon. So let's touch base on the 2021 individual base plans from Common Ground. Again, keep in mind, as Megan mentioned earlier, that we will be sending out a copy of this webinar presentation, the PowerPoint deck. And as an appendix to that, we will have detailed grids of all the plans that we go through. So I'm not going to go into the weeds on a lot of the detail. I just want to give you the highlights. So we're moving from 7 plans in 2020 on the individual side to 9 plans in 2021. We're going to be adding 1 gold plan and 1 bronze plan to the mix. So a little more flexibility there. We will have a bronze HSA plan available. And one of the things that we did adjust for 2021 is that in the past, if you were quoting some of our bronze plans and you were going through the marketplace and the tax credit exceeded what the base premium was, there was oftentimes still a residual amount of premium, oftentimes under $1, that had to be paid. So we've made that correction in 2021. So you should see some bronze plans, again, with the base premium less than the tax credit availability, zeroing premium. So that's one of the nice changes that we're making for 2021. So on the deductible and out-of-pocket max side, I'll just mention 2 adjustments for 2021. So the deductible max on individuals is going up to $8,550. On family, it's going up to $17,100, and that's the same also on the individual and the family side for the maximum out-of-pocket. Our co-insurance levels are going to be at 0%, 20%, or 25%, depending on the plan. For those plans that do have a co-pay provider, they'll run from $25 to $60 to see a primary care physician, and they'll run from $50 to $120 to see a specialist. Again, keep in mind that if a member needs to see a specialist with Common Ground, because of our setup, they do not need a referral to go see a specialist. For the plans that have prescription drug copays, those will run from $10 to $100 for the Tier 1 through Tier 3 medications. And for any specialty prescription drug situations or Tier 4 meds, there is a 30% or 40% coinsurance after the deductible is met. We'll also have a skinny silver plan next year. We had it this year. Basically, it's a silver plan where there's a separate prescription drug deductible on the Tier 3 and Tier 4 medications. So that markedly brings down the premium on that plan. Obviously, it's not something you're going to recommend to a client that's on a lot of medications, but for those that want some of the benefits with a silver plan and looking to save some dollars from a budgetary standpoint, that's often a very popular plan that members do gravitate to. On the cost share reduction plans, we will have 9 plans next year. On the CSR side, same as in 2020. They're all based off of our silver base plans. Again, deductibles on those are going to range from $50 to $3,400 on the individual, $100 to $6,800 on the family. Maximum out of pockets, the max on the family is $6,800. The max on the individual is $6,800. The max on the family is $13,600. Co-insurance is going to range from 20 to 25%. The provider co-pays, will range from $5 to $40 for a primary care physician visit, or $20 to $80 for a specialist visit. On the prescription drug copays on those tier 1 through tier 2 medications, that'll range from $0 to $75. On the tier 3 meds, that all goes to coinsurance and deductible. And then on the specialty or tier 4 medications, there's a 30% coinsurance after the deductible. Two of the plans we don't mention very often that we do have available, and we do get a couple questions every open enrollment period, are low-cost share and no-cost share plans. So we do have those plans available. On the low-cost share plans, we have 8 of them, and they're available to members of federally recognized tribes and Alaska Native Claims Settlement Act corporation shareholders, regardless of income or eligibility for premium tax credit. So I'm not going to go through them in much detail here for you, but what they do is they kind of ease up on the access and make them more affordable for individuals that would qualify into one of those groups. On the no-cost share plans, which is the next slide, basically, again, the same groups would qualify: federally recognized tribes and Alaska Native Claims Settlement Act corporation shareholders. The difference here being is that you would be going through healthcare.gov for the marketplace, and if their income is between 100% and 300% of the federal poverty level, and they qualify for premium tax benefits, they could possibly qualify for one of these plans. And there will be 8 of them, and basically they're no cost share. So they're paying whatever the premium is, and if they're going in for eligible service to an eligible provider, they can go in with basically no cost for those services. So very small part of our business, but just to be aware that they are out there. And if you have any questions on them down the road, please feel free to contact us. One of the great new benefits that we're adding for 2021 is a $15 insulin benefit. So Megan had mentioned before that we exist to be of service to our members, and as a cooperative, we want to make sure that we remove as many barriers as possible and create a sense of relief for members when we can, when it comes to accessing and utilizing healthcare services. So as you know, there are a lot of folks in Wisconsin and around the country that are diabetics. Many of them are insulin dependent. You've probably heard it from talking to your clients. We've heard it currently at Common Ground that there are sometimes situations because of where somebody is or a family is financially that the burden of paying for the insulin becomes pretty cumbersome, and they may go without, or they may skip days of treatment, and obviously that's not good for them on a daily or a long-term basis. So we kind of stepped up, and what we're doing is on all Formulary 2 insulin products, there is a $15 insulin benefit. So it's a reduced copay of $15 for a 30-day supply, and this is going to apply before the deductible. So again, as a co-op, we feel that we have the ability to provide this type of a benefit, and I anticipate it's going to be very well received. So be aware that that will be available on all of our plans except for the bronze plans. Okay, so keep that in mind. Let's touch on Virtuel. Virtuel is our 24/7 online clinic. It can be accessed by members on their smartphone, on a laptop, on a computer. And basically, it's not going to replace urgent care or emergency care. It's not going to replace a doctor's visit to a primary care doc or a specialist if that's on the schedule. But if there are situations where somebody has a medical condition going on, maybe it's in the evening, maybe it's on the weekend, maybe they're out of the service area, maybe they're out of state, and they do want to at least touch base with somebody to see if they can get a diagnosis and maybe a plan of treatment. This is where Virtuel comes in. So on all of our plans, it's included. On all plans except HSA plans, the first 10 e-visits in a calendar year per individual on the policy are free. So basically all you do is you log on to virtuel.com. It's kind of like going in to see a primary care doc. You put your information in as to who you are. You answer some questions. You submit the information. Within 30 minutes, a board-certified nurse practitioner is going to get on back to you with a diagnosis, what they anticipate as your plan of care. If they're indicating that you should get prescriptions for your situation, they can wire them over to a CVS or a Walmart or a Walgreens, whatever is in network from a pharmacy standpoint. So what's really nice about it is that it's available 24/7. It's a very flexible way and a very inexpensive way to receive health care when you're in a situation where this is going to be something that's advantageous to you. Another nice little benefit we have on our individual plans is a couple of extra benefits for Wisconsin college students. So if you have a client and they have a son or a daughter that's on the plan, and let's say your client, they live in Marinette or Brown County or Outagamie or Racine, and they have a son or daughter that's going to an Institute of Higher Learning within the state of Wisconsin, but outside of our service area. Such as maybe they're going to UW La Crosse. So in addition to the regular in-service area benefits and emergency care and urgent care outside of the service area, they will have the ability to have one clinical assessment by an out-of-network provider and up to 5 counseling visits for outpatient behavioral health, substance abuse treatment, or any combination of the two. So at the bottom of the slide here, we have a hyperlink. And if you open that, you would have access to a certification form. Basically, what we're asking is the name of the primary member subscriber, the name of their dependent son or daughter, where they're going to school, to confirm that's in the state, and that they're currently actively enrolled in that university or college. So again, it's a little thing, but it's sometimes the little things that really help, especially if there's a family that have any sons or daughters that are going to school outside of the service area, but still in the state of Wisconsin. So a couple of reminders we're going to touch on are the renewals, which as we're coming up here for open enrollment is a pretty big thing. We're going to touch on January invoices and also the requirements to sell Common Ground Healthcare Cooperative products. So on the renewals, in the past, what we've done is we have sent out to you renewal information in the form of an encrypted email. And in that email, when you open it up, you're going to see an Excel spreadsheet that notes all of your members that are renewing, what they're currently at premium-wise, what plan they have, what they're moving over to on the renewal. If they decide to take the renewal that's offered, obviously in those 15 days of open enrollment, they can change that, but it's based on the information we have at the time of the renewal. So we had been sending those out, again, via an email process, encrypted. That's not going to happen as we go into open enrollment here for 2021. So we brought in a new admin system back on May 8th of this year, JET. And one of the nice things about JET is that we are going to be able to load the 2021 renewal information into your broker portal. So everything we would have sent you last year via an email and more is going to be in your broker portal. So I know a lot of you have, since we implemented the new system, have gotten into the broker portal, are learning how to navigate around it. If for some reason you have not done so and you have renewal business coming up with Common Ground, please contact us and let us help you get reset and reactivated for your broker portal so that you will have immediate access to that renewal information as soon as it's available. So when it is loaded into the system, we are going to send you out a heads up an email to alert you when they are available. And from a timing perspective, we do it in 2 stages, okay? So obviously there's 2 types of policies. There's non-APC, and that's whether somebody is direct or off the exchange for Common Ground, or they might have a plan on the marketplace, but they don't receive a tax credit, but that's where they're originating. So in those situations, the renewals are going to be going out to the members in late October. So coming up in about a month from now, those renewals are going to go out to the members. For those clients and members that have a plan on the marketplace, they're getting a tax credit. Those renewals will go out the first week of November. And the reason being is that we wait for the last accurate bar file. It's kind of a condensed file from the marketplace that contains the most recent up-to-date information on plans, demographic profiles, income, so that when we generate that renewal, it's as accurate as possible when we send it out to the members, and it's much better than doing it earlier and sending out estimates that may not be current. So that's kind of the timeline on the renewals, and it's pretty much how we've done in the last few years. So for renewing members or auto renewals, here's a timeline to be aware of. And so we've got some significant dates that you should take note of. So we will generate on renewal business, we will generate January 2021 invoices between December 2nd and December 8th. Okay, so kind of that little over the first week of December, we're going to generate those January invoices for renewal business. And that renewal is based upon the data we have as of the end of business day on November 30th. So if you have any clients that have plans on the marketplace, we strongly advise that if they are renewing, that even if they want to renew to the plan that's offered to them, to make sure that they go to the marketplace and make sure that their income level is accurate. Because obviously, as you know, that can move them into a different plan or a classification that can slightly or quite a bit impact their tax credit. So whatever data we have, whether it's a direct plan or an on-exchange plan, as of November 30th, that's what we're going to use to load into the invoices, okay? So we'll send those invoices out based on that data between the 2nd and the 8th of December. And the other reason it's important that that information is as accurate as possible is that a lot of clients and members are set up on auto pay or recurring payment, okay? And that can be set up between the 15th and the 25th of every month. The vast majority of the recurring payments start on the 15th of the month. So if we're generating an invoice for January and it's based on November 30th data, and between that date and when the recurring payment pulls, there is a change in the premium for that member, we're going to pull the premium that we have calculated as of the end of November. So if it has changed significantly and they're on recurring payment, we would strongly advise them, or if you have the authority to put a stop on that recurring payment, have them make a one-time payment so that we aren't pulling an inaccurate amount out of their account or charging it to their credit card. And then if they make that one-time payment on the adjusted premium amount, they or you can go back in afterwards and reset that recurring payment to run through the remainder of 2021. So keep that in mind, that November 30th is a hard date on the renewal business that we are going to use to populate those invoices and use to do recurring payment pulls. The other date to be aware of is December 25th, and really that's when January payment is due to avoid grace period or termination if a member is already in the grace period. So on new members for 2021, obviously we do it a little differently. So here's some important dates and kind of a timeline on that. So as soon as we receive the enrollment, and we process it and tee it up and approve it in the system, we're going to generate the January invoice for 2021. So when that file comes over to us from the marketplace and we tee it up, or it's a direct application that you do on the broker portal, or you send us a paper app, which we still do, accept those. Once that's set up in the system, we are going to generate that January invoice. If for any reason they make a change in their plan or their premium, and that change is made before they make their first payment for January 1st of 2021, we'll go back and we'll generate a new invoice so that it is as accurate as possible for them, okay? So we've got the flexibility to do that, so just keep in mind that that change has to be made before that first payment comes in. Once we do get the first payment for January, two things happen. One is the plan becomes effectuated, which means that we activate the coverage for January 1. The other thing is that that puts in the order for their insurance ID cards. And so I know a lot of you stress to your clients, especially if they're new clients coming over to Common Ground, is to make that initial payment as soon as possible, because that gets the plan activated, that gets the ID card process rolling, and it's especially important if during that first week of January, they're looking to go in for medical services, or something happens that they need to, or they're looking to pick up medications. It's kind of nice to have that plan active and the cards already in their hands, so that that process, that experience for them works as well as possible. If they do make their first payment and we've processed it, and for some reason there's a change in the plan which changes the premium or whatever, we're going to make that change on the February invoice. So the January one is going to be off because that change came in later than when we generated the initial invoice, but afterwards we're going to make that correction in February for them. And then the final day to make a January payment is January 31st. So that is the date that that payment has to be in and processed in order to make sure that plan is effectuated for January 1st. Those ID cards get put into the system as an order, and that plan does not get terminated out for non-payment. So those are just some key dates and some timelines, and this is the same process we're using in the upcoming years as we use for 2020 open enrollment. On the payment option side, this hasn't changed. There's a couple of different ways that folks can pay their premium. A lot of members will go online and make a payment. So if they're a new member or if they're an existing member and they want to do one-time payment, they go to commongroundhealthcare.org and click Pay My Premium. If they are brand new, they're going to have to register, which is a pretty easy process. They answer a few questions, set up a password and a username, just like any other account you set up online. They're going to sign into the payment portal. They can pay via bank account or a credit or debit card. So from a credit card standpoint, we are accepting Visa, MasterCard, and Discover cards. They can also set up recurring payments. So especially if it's a new client, we recommend that the first payment be a one-time payment, again, either through a credit card or coming out of a bank account if they're doing it online. And then after that, set up a recurring payment so that whether it's starting on or between the 15th and 25th of January, it's going to start pulling for February and then the consecutive months afterwards that they have coverage with Common Ground. They can also mail in their premium. So if they do, they can mail it in via check, cash, a one-time bank or credit card authorization slip. Sometimes we even get money orders. And if they send it in via the mail, it'd be great if they included the invoice stub along with that payment. It's also a very good idea that whatever document they send in as their payment mode, that they write their subscriber or member number on that document. Keep in mind, we've got the mailing address here on the slide for you. The mail-in payments do not come to Common Ground in Brookfield, Wisconsin. They go directly to the bank. So when they go to the bank for processing, the bank is looking at, obviously, the payment document. They're looking at that be at the reception area, okay? And they can do that. They can drop off cash. They can pay by check or money order or via an electronic payment slip authorization. We do offer postage-paid envelopes. If they want to pay by credit or debit card, there is a one-time credit card or debit authorization form they can fill out. And they just come to our office in Brookfield, Wisconsin. That's 120 Bishops Way, Suite 150 out in Brookfield, Wisconsin. So even though still the majority of the folks at Common Ground are working virtually, we do have people working in the Brookfield office, and so there will be somebody there that can accommodate clients and members if they want to pay by dropping it off. One reminder is that Common Ground has not, and we will not in 2021, be accepting payments by phone. So it also has to be done online through the mail or by dropping in if they feel that they want to go that route. So agent of record changes. We consistently get agent of record changes throughout the year. There are two different ways, two different processes that we handle those. If the member has an application or a policy that originates on the exchange or healthcare.gov, the marketplace must be contacted to make the change by calling them at 800-318-2596 or by logging on to the member's healthcare.gov account and making that agent change. Now, when that's done, if they want to set you up as the agent of record going forward to service them in their account, obviously, as you know, make sure that your NPN number and your name is on that updated application, because what will happen is that the marketplace will then send us an update file. Based on that file, we will adjust the member's record. And then going forward, you would be the assigned agent of record and be credited for the business going forward from a commission payout standpoint. So any on-exchange agent assignments have to be done through the marketplace. Now, if the member is direct or off exchange with Common Ground, much easier process. We just need something in writing from them. They can put it in a letter form. They can do it via email. They can send it directly to us at sales@commongroundhealthcare.org, or they can send you an email saying, hey, going forward, I want you to be my agent. You send that to us, and at also sales@commongroundhealthcare.org, and we'll make that change internally, and then going forward, you'll be the agent of record, and we'll be paid accordingly to service that account. And keep in mind that that assignment has to be completed before you're able to assist a current member with their policy or renewal. So obviously, until that assignment processes through, they won't show up in your portal, and you won't be able to actively service them with Common Ground type issues. So the requirements to sell Common Ground, obviously you need a current Wisconsin health license. You need to be appointed with Common Ground Healthcare Cooperative and abide by the broker agreement and provisions. And if you're doing any business on the marketplace, as you know, you need to complete a CMS individual certification training for 2021 on the individual side. For any of you that are doing small group and making recommendations or working with employer groups through the marketplace for SHOP, there's also a SHOP certification that you would need to complete. Often we can track those electronically, but if you do want to send us copies of them, scan it, send it to us via email, and we'll make sure we attach it to your agent profile on our end. And that certification information, especially on the marketplace, has to be done prior to or the same day the business is enrolled or submitted. So we're going to talk a little bit about some new commission changes, which I think you'll like, rate changes, and touch really briefly on our small group relaunch. So as Megan has said, about 45% of the business that comes into Common Ground is through you, the brokers and agents. Now it'll be in our 22 counties in eastern Wisconsin. We really appreciate the business. We wish more of the business would come in from your end, because we know that those members, those clients are better schooled up on what they're buying, why they're buying it, and how to use it. So we recognize the value that you provide to them and to us. So we are making a change on our commission schedule effective January 1st, 2021. And it's kind of a two-tiered system. So here's how it's going to work. So for new members, effective as of January 1st, 2021, you will be paid $20 per member per month. And that will carry on into also the following years on renewal. So what that means is that if you have one individual coming on, you'll be paid $20 for that individual. If it's a husband and wife, 2 times 20 is 40. If it's a husband and wife and 2 children, 20 times 4 is 80. So it's a pretty big uptick on the commission side for new business coming in as of January 1st. So a question we often get is that, okay, what if I have a client, he or she or they were with Common Ground in 2018, 2019, and then for whatever reason, they went to another carrier in 2020. Now they want to come back. They come on back, that's new business. If it's a couple, you'll be paid $40 per month, 2 times 20 for that business. For the renewing block of business, those folks that are continuously renewed here in 2020, and they renew into 2021 in January, that'll be a grandfathered commission schedule. Those will still be paid at $20 per policy per month. So again, we thank you for your business. Hopefully this will be well received, and you can generate some additional income for your practice based upon a new schedule we have coming into 2021. Let's talk a little bit about rates for 2021 on the individual side. So overall, our individual rates on the base plans are going to go down about 6.1%. Now with Common Ground, what we do is we break up the 22 counties on the eastern side of Wisconsin from Florence down to Kenosha into rating areas. So we have 5 rating areas. So the amount that premium is going to change is dependent upon the rating area. So if we look at rating area 1, our base premium is going down 5.9% on average, and that encompasses Milwaukee County. So pretty nice drop in Milwaukee County. Rating area 9, it's going down 4.3%, and that encompasses Kenosha and Racine counties. Rating area 11, the premium average is going down 9.6%. And in rating area 9, we have Calumet, Fond du Lac, Outagamie, Sheboygan, Waupaca, Waushara, and Winnebago. In rating area 12, that is the one outlier. We're going up about 5.1%. And that rating area includes Ozaukee, Washington, and Waukesha counties. In rating area 16, the base premium is going down about 9.9%, so that is the greatest reduction of all the rating areas, and that includes Brown, Dorr, Kewaunee, Manitowoc, Marinette, Oconto, and Shawano counties. So again, as a cooperative, from a financial standpoint, we're very strong going into 2021. Things we do try to do, if possible, is to utilize that financial strength to make adjustments on the premium. So in the small group plans, I'll touch really briefly on it. We did a webinar maybe a month and a half ago where we have a nice block of small group business now with employers from 2 to 50 lives. We're looking to significantly increase that amount of business in 2021. So historically, our small group plans have been PPO plans. As we talk to brokers on the relaunch of our small group platform, and we talk to employers, one of the key factors for small group health insurance is obviously affordability. So what we're doing is that we're moving our platform from a PPO to an EPO. So again, individuals on those group plans will have to seek the services in network amongst our healthcare partners, Aurora, Bella, ThedaCare, et cetera. And that's going to be effective for January 1, 2021 effective dates for new business, as well as any business that we have currently that will be renewing in January or throughout the year in 2021. So we're going to have 19 in-service area plans. So right now we have less than 10 of them. So we're almost doubling the number of plans we're going to have for in-service. We're going to have 6 out-of-service area plans. So if you have a business owner client and they want to set up a group with Common Ground and they have an employee out of the service area, maybe they're living in Madison, maybe they're living in Peoria, Illinois, there's going to be up to 6 out-of-service area plans that they can pick. And again, that's all going to drive through the Envision network. So a narrow network than we've had in the past, but we should be seeing significantly reduced premiums by going this route. And we're pretty enthusiastic about the ability to grow that book of business with these changes coming in on January 1st. So, if for any of you that have any group renewals coming up, whether they're with Common Ground or they're with other carriers and you want to take a look, hopefully, shortly we should be able to do some quoting for January 1. So definitely reach out to us and provide us the census information, and we'll be more than happy to run those proposals for you. And I'll finish up with some of our the contacts here at Common Ground. A lot of you, we know, use the broker hotline. So when you use that number, hopefully you get somebody live on the phone that can answer your questions or track down whatever you need regarding either a product or something that your client is looking for. And that number is 888-870-4717. We also get a lot of email requests. And if you have a general question and maybe you don't want to call, maybe it's after hours, you can send anything to us via email at sales@commongroundhealthcare.org. So from a staffing standpoint on the sales side, there's Deb Tryan. She's our director of sales. She just came on board in August, and she spent 13 and a half years at Dean Health Plan. So she's been in the business quite a while, and she knows her stuff, and we're glad to have her aboard. Megan Enerson, who started the webinar presentation, myself, obviously, April Schultz, who I know a lot of you have talked to or emailed over the years. And then Heidi Heiches, she came over and started working with us in August of this year also. So we are fully staffed currently at Common Ground on the sales area, and looking forward to working with you in the upcoming open enrollment. In those situations where you have a member or client that needs to give us a call, regarding their policy, their premium, who's in or out of network, anything related to claims, they should always be calling our member services area, and that number is 877-514-2442. So with that ends my portion of the presentation. So I think we're going to open up to any questions that you might have.
Thanks, Jim. So it looks like we don't have any current questions in the chat box. If any questions do come up, feel free to reach out to us with the contact information that you have up on the screen. Like Jim and Megan mentioned, we will be sending this out by email tomorrow, along with some benefit materials and just some materials that'll help make this open enrollment a little bit easier on our side. So we will be sending that out, so just be on the lookout for that in your email box. As always, we appreciate your business, and we thank you for joining us today.
Great, thank you.
Thanks, everyone. Have a great day.